Hello, everyone. Good morning, good night, good evening, wherever you are. Welcome to my channel, Autism Speaks. Are you listening? Thank you for joining me for one more video. Okay, guys, so today we're gonna be just going over some things that I previously mentioned in my introductory video. As I mentioned before also, that I have two children that were placed on the autism spectrum, and so the contents that will be spoken about on this platform will be just giving tips as to how I've been managing so far with this condition, and also ways in which I can impart information to you for those who may have children with these symptoms and you're not certain as to what next to do. Hopefully this video will be found insightful and hopefully it will be impactful for you. So I'm just going to be going over some notes that I wrote. What is autism? Autism is a developmental disorder that impairs or affects an individual's ability to communicate or interact. And I'll be looking back and forth on my notes, so please forgive me. So it's a developmental disorder. It impairs the way the individual communicates. So it impairs their ability to communicate. Typical thing, for example, just to communicate their needs. They struggle with this. You would have to know the child to be able to know what exactly they are requesting or what exactly is the problem. And oftentimes you won't have a solution. You won't have an answer. You're going through stuff like, okay, do you want to go potty? Do you want to go sleep? Do you want something to eat? Do you want juice? Do you want water? So you're going through a list of things, and hopefully the child is able to relay exactly what they want. They may not be able to verbalize what they want or their needs. However, they can use cues, for example, tugging you, pulling you towards whatever they want. For example, pulling you to the pantry to get a snack, or pulling you to where the juice is kept so they can get a juice, and so on. So there are 5 types of autism, right? First one is Asperger's syndrome, and this is termed also as a level 1 autism. And these individuals, they have high intelligence, they're able to function, but they have some social awkwardness. So they'll be able to speak with you intelligently, answer your questions appropriately. However, they are unable to socialize on some social norms that we know about, and that's what makes them awkward. So they have issues with social communication. Okay. Even though they are above average, they're intelligent, strong verbal, they have some of the best jobs, and some of them are engineers, they are doctors, nurses, and you'll wonder, how is it that they have autism and they're able to function in that aspect? And it is because of this level that they're on. They're on level 1 autism, or it can be termed as Asperger's syndrome. You also have the Rett syndrome. And it's just a developmental disorder that is noticed more so in infancy. It affects girls more than boys. Another one is Kanner syndrome. The children may appear attractive, alert, intelligent, with underlying characteristics such as lack of emotional attachments to others. They have issues with communication, and they may have issues with their interaction. Another one is pervasive developmental disorder. It is a mild type of autism, and the symptoms they may have, like challenges with socializing, language development. Okay, So the term autism, because you have so many types and it's a spectrum. So you can have one end to another, okay? You can have mild autism, you can have, moderate, you can have excessive or severe autism, right? That is why it's a spectrum, it's continuous. People can have different symptoms, different challenges. They're some of them are high functioning, and we use that word very lightly. They're high functioning in the sense that they would look just like you and I. They're able to communicate appropriately and so on, and so they're able to also mask certain signs and symptoms. So some of them you won't even know that they're autistic because they're trying their best to mask their symptoms, to behave appropriately, to communicate appropriately, and so on. Okay, so as I said before, it is a spectrum, autism, one end to another. However, the term is used now. So now you're not finding where people are saying there are 5 types of autism. Now they're using the term autism spectrum disorder, which kind of umbrellas all of the different diagnoses that would have fallen under the spectrum previously. For example, Asperger's disease. So now everybody is saying the child is autistic or is on the spectrum. You would often hear people say, my child is on the spectrum, or that person or this person is on the spectrum, and that is to refer that the person is on the autism spectrum and not necessarily to speak about a particular type of autism, okay? And so autism have different levels, and when you're diagnosed with autism, or when an individual is diagnosed with autism, it is important that you know which level the person is has fallen on, right? And sometimes it's difficult because when an evaluation is done and the child is diagnosed with autism, then the evaluator, the psychologist, or even the pediatrician can diagnose the child with autism. They should be able to tell you which level the person is on, and the level also depicts how intense the treatment will be, right? So you have level 1, which requires support. The person may be deemed as awkward. They are not disabled. They're able to function to some extent independently. They're able to go to school. They're able to dress themselves, to do their activities of daily living, or everything that you would do on a daily basis. You get up, you brush your teeth, you use the potty, you wipe appropriately, you wash your hands, you're able to feed yourself, dress yourself, and so on. These are deemed as activities of daily living. And a person that falls under level 1 may have this capability. They're able to function independently. Level 2 requires substantial support. The child or the individual may have significant developmental delays, or they may be able to meet their milestone later on in life, okay? So they will need some support, not excessive support or substantial support, okay? And the third level is level 3. Level 3 requires substantial support. These individuals are obviously disabled, or it's obvious that they have a disability or some impairment, and they have large amount of developmental delays, and they may not meet every milestone, okay? How do you know that your child is on the spectrum, or a family member or a friend? Sometimes you can look on a child or individual and know that they are on the spectrum if you are familiar with the condition or the diagnosis. And so this patient may have aversions to touch. They don't like to be touched. They don't like people hugging on them or kissing on them and stuff like that a regular person may like, right? They have sensitivity to noise. So you'd find them covering their ears if there is like a loud noise. For example, if they go in crowds. They go to the park or the amusement parks or anything like that, where you have a lot of loud noise or a lot of crowds. They don't like that. So some of them, if they are in a situation where they have a lot of people around them, they'll be screaming and crying, behaving like, they're irritable, something is happening to them. Is that they don't like to be in that space where a lot of people are, right? The noise, you see them covering their ears. If you're talking sometimes and it's getting to them, they have that sensitivity where they'll be covering the ears or screaming and stuff like that. And that is sensitivity to noise. You may see them tiptoeing. They're walking on tippy toes, flapping the hands when they're excited. Delayed speech. They prefer to be alone. They prefer to play alone. They avoid eye contact. You're talking to them and they're not looking at you. They're looking all over the place and not directly focusing on you, right? Echolalia. So this is like they're repeating words or phrases continuously, and a normal person or an average person would not be repeating words like that normally. For example, sounds, they're repeating sounds. This would be like nonsense to some people, but this is also a symptom or a sign of autism. They're unable to recognize danger signs, so they will walk out in the road. Car is coming. They're not able to recognize that a car is coming and a car can hit me. I can die and stuff like that. Or they're not able to connect those points that, if I walk out in the street, I can die because a car can hit me. They're unable to communicate, or they have issues communicating, relaying their needs and their wants or their feelings. They are feeling sad. They're feeling irritable. I'm having a headache. I'm having a tummy ache and stuff like that. They may be unable to relay this information. And this is not, as I said, it's a spectrum. So some autistic individuals are able to relay their needs and their wants. It depends on where on the spectrum they fall, okay? And they do not respond to their name. So when Shamir was younger, when he was like, I would say like 1, 2, thereabout, I noticed that he wasn't responding to his name. So I'd be calling Shamir, 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 and he's looking all over the place. And that was one way that I recognized that he was not meeting his milestone, right? A typical child, if you call their name, they would look at you, right? They're looking towards where the sound is coming from, or they would be familiar with their name and they would look at you just for that reason. They may be behaving hysterical for no different reason that you can even point out, okay, this is what's happening, this is why they're behaving like that. A lot of times you don't know as to what is happening with the child, okay? And I'm just going to briefly go into some ways in which autism is managed or treated. So the key to managing autism is to detect the condition early. Early identification of the signs will permit the child to start therapy soon. And so this is one of the reasons why I launched this channel, is to create some form of awareness. Because a lot of people don't know. A lot of people have children on the spectrum and they don't know that they're on the spectrum because they don't know what signs and symptoms to look for. They're just like, oh, this one is developmentally delayed or whatever. Okay, so the paramount thing is that you detect autism early so that you can have the child start therapy as soon as possible. And therapy will aid the child to, develop skills that they will need in life to sustain them, right? And with therapy, the possibilities are endless. You don't know what this child can become in life. This child can be the next president. This child can be the next vice president. The possibilities are endless, I always say. And it doesn't matter if your child is on the spectrum or not. What tools are you going to give your child to be the best version of themselves, right? And that is my go-to statement every day, is that I am happy that God made me with the tenacity that I have and the drive that I have to go for whatever I want, right? And I know the needs of my children. They may not be able to relay their needs and their wants, but I know. And so because I know, what am I going to do about that? My job is to advocate for my child or my children as much as possible, right? And one way of doing that is me getting them in therapy, giving them the necessary tools that they need so that they can be the best version of themselves, okay? And so the main types of therapy or therapies that they have are speech therapy, occupational therapy, and ABA, or applied behavioral analysis. And a lot of parents with children on the spectrum have different inputs as to how effective this can be for them. And so I will just put a disclaimer here that whatever I speak has to do with my experience with this disorder, right? And so the therapies that I'm about to talk about, my children, they are getting these therapies and they have been effective so far, right? And so this is my experience that I'm referring to. So speech therapy is the assessment and treatment of communication problems and speech disorders. And so a lot of persons have issues with speech. This is not only for persons who are on the autism spectrum, right? So you have persons who've had a stroke, and speech therapy would be very effective for them. You have persons with a lot of speech impediment, for example, persons with lisp tongue, they're unable to pronounce their words properly. Speech will help. And you have many other conditions where the child is able to comprehend what is being said. However, they are unable to enunciate or pronounce the words or whatever, right? But you know that they understand. You tell them, go get me this pen, or take this pen to dad. And they're able to carry out every command that you give them. However, they are unable to speak. And so speech therapy is effective in that way, or it can help. A lot of persons are doing speech therapy for years. It's not a quick fix, right? And so it's encouraged to have speech therapy regularly so that you can see the effectiveness. Another therapy is occupational therapy, and it involves the therapeutic use of everyday activities or occupations to treat the physical, mental, developmental, and emotional ailment to improve performance of everyday activities. For example, a child on the spectrum may have issues dressing themselves, and so occupational therapy will help in that sense. They have the child dress themselves. You put the bottom on, the top, socks, shoes, and so on. Coat. They do these things every day in occupational therapy. They'll have the child drawing, coloring, cutting a paper with the scissors and stuff like that. These are issues that children on the spectrum may have, amongst many other issues that occupational therapy may be effective with. And ABA, applied behavioral analysis, is a therapy that helps kids with autism help them to learn skills and lessons problematic behaviors. Example, hurting themselves. This will help to reinforce positive behavior, which eventually will have these children repeating positive behaviors, okay? And so these are just 3 types of treatments or management. And this is just the tip of the iceberg in regards to managing autism, right? There are many other ways of managing, and we'll get into those later on as we continue to dissect what is autism. How do we help our children to be the best version of themselves? This is a journey. This is a rough one, I would say, from the time of diagnosis of autism until now. I can see the different changes in my children, and with Shamir, which is 6 years old, who is 6 years old, with him, I tell you, God has been so good, and I can only speak to God being the one to help with Shamir's development. Shamir was diagnosed with autism at 3, and he was placed on level 3 autism. Likewise, Shade, they were both placed at level 3, and as I read before, that level 3 needs substantial support. Level 3 may have issues with communication, developmental delays, and some may have issues in meeting their milestones. And God is able to do all things, and so I can see already where therapy has helped Shamir. Shamir used to be like a blank wall. Me talking to him, calling his name, he would not be looking at me. He would not be responding appropriately. And so I had him in therapy. I had him as soon as I realized something was wrong. He wasn't developing right. And, when he was born, I think up until when he was like 6 months, he would behave appropriately. I believe he was on point with his milestone. He would look at me, he would smile appropriately, laugh, he would play, and we would have the best of times. But when Shamir hit like 1, 2 thereabout, I noticed that he was unable to feed himself. He wasn't talking. He was just babbling, and at that age he should have had words in his vocabulary. And so I reached out to an organization that they would do like early evaluations and so on, and they said, oh, he has red flags for autism. And I was like, no, I'm not accepting that. I'm not accepting that. And so I still allowed him to do therapy. He was doing therapy in the daycare, at home, and he wasn't diagnosed until he was 3. But prior to that, we would be going back and forth with the pediatrician to have Shamir evaluated. And at that time, I was new to these things. So this organization, I would say, he needs speech therapy. He cannot talk. Can he not get speech therapy? And they were like, oh, he cannot talk. Speech therapy would not help him, right? This was before he was diagnosed. And so I thought I had to get the referral from them to get speech therapy. And I was conversating with someone, I can't remember who, but they mentioned to me that, did you not know that your pediatrician can give you a referral for speech? And I'm like, oh, really? And so my pediatrician was well aware of what was going on with Shamir. But I was told that the pediatricians, they don't rush into diagnosing a child with autism because of the stigma and all of that. And so they want to give the child time to come into themselves and so on. But he gave me the referral for speech, and so we were doing speech. And the other organization that Shamir was in, they told me that They did their evaluation when Shamir turned 3 because he would have opted out of their program, and they were like, "Oh, he's not autistic. He has developmental delays, and he can go into the public school with this diagnosis." And that was that was a wrong decision for them to make, more so for me to get Shamir enrolled in public school at age 3. Shamir was lost. He didn't know what was going on, and the expectations that they had for him, they were great. And Shamir was like the smallest child in that school, and so at that time, I'm sorry, this video is a little lengthy, but at that time, I was pregnant with Shade, and so I was worried that, all of this is going on with Shamir. Now I'm pregnant. What if something happens to this child? And so at that time, I asked for a genetic workup for myself. And so they did the genetic workup. Everything was okay. And Shamir, I think I had a genetic workup for Shamir also, and everything was okay. His genetics were okay. There was no abnormalities found and all of that. So I'm like, okay, so he doesn't have autism. But let me tell you, autism, you cannot do any genetic tests really to find any diagnosis of autism, because autism is strictly, the signs and symptoms are strictly behavioral, okay? And so that's where I was misled, or I was wrong to have believed that, okay, so the genetic exam is negative, and so autism is not on the table, guys. So I kept on going back to the pediatrician. Listen, can I get a referral for a neurologist to see him? And so I went to the neurologist, and she saw him twice. The second time she saw him, I believe that she rushed into her diagnosis, because she had asked Shamir, take this pen to dad. And Shamir was unable to do that. And so she said, oh, he's autistic. And she rushed into, as a neurologist, I believe that you should have done more to evaluate this child. However, the good thing that she did was to give me a referral for the Unicorn Foundation with Nova. If you're in Florida, you may be familiar with this organization. I took Shamir there, and they did a lengthy evaluation on him, and that's where he was diagnosed initially with autism. And so, Shamir went to public school for like a year. I pulled him based on their recommendation. He was on level 3. He needed intense therapy, speech, OT, and ABA they had recommended. And so I pulled him from the public school, in which he wasn't getting any of those. And I put him in a day program where he was going every day to do ABA, speech, and OT. And this is my experience, as I said before. Shamir was like a wall. Talking to him was like blank. You're not getting any form of communication reciprocated back to you, nothing. It's like you're talking to a person that's not there. And Shamir had like a year or so of therapy, and my husband would do recordings of videos where they had Shamir. Shamir learned how to read. Shamir learned how to follow certain routines, like going to the bathroom, using the potty, wiping, washing your hands, and so on. And when I saw the progress Shamir was making, and this was after therapy, and the therapy, he graduated out of that program, and they said he was one of the first students that they saw, or that they dealt with, that grad out of their program so quickly. Shamir was doing exceptionally well. Shamir was reading a story. He probably wasn't able to comprehend the passage, but he was able to read a story. And so that's where I can give credit to ABA, to speech, and to OT. right? Because I can see the progress, the end results. And today, Shamir is able to respond to his name. Shamir is able to follow 1 to 2 steps direction. I can say, Shamir, put this cup in the sink and turn the lights on, and he's able to follow, right? He's not 100% in terms of his development, but as I said, this is great. And this just shows you that even though your child is diagnosed with autism, it's not the end of the world, right? It is a struggle. It is a struggle. I took it very hard. I would cry every day. I would go in depression. I would pray. I would ask God, why is it that you would give me children like this when other people, I'm serving you, I've been serving you for so long, and other people who don't even care about you have healthy children. And so this was a question back and forth with God. I'm asking, why is it that I have to go through this? Why is it? And after Shade was diagnosed, oh, it just opened up everything again. And I've been asking God, not one but two, how am I going to do this? How am I going to do this? But let me tell you, God provides. He provides for his people. He provides for these children. These children are perfect in his eyes, right? And he makes no mistakes. And so I'm not going to say it's not hard. It is hard. It is a daily struggle, especially when you get reports from school that your child is doing this or not doing this. It hurts because you feel helpless, you feel hopeless, you feel like you're not able to help your child in some essence. But all is not lost. And as we continue to, go into certain topics on this channel, I welcome your inputs. I welcome your feedback. What are some of the struggles that you're going through? What are some of the issues that you're going through with your children, right? The struggles, they are real. And this channel is going to be very transparent, and a lot of persons are going to be upset. But the sooner we face the facts, is the better we're going to be, and the faster we can meet our goals, especially with our children. The sooner you get your child evaluated, if you feel like your child is on the spectrum, the sooner you get your child evaluated, you will be prompt to grab a hold of the tools that you need necessary to give the child the best life that they can possibly have. Right? Waiting around for I don't know what, delaying getting them evaluated will not help them. And yes, I am a firm believer in God, right? I believe in God. I believe in his word, right? But God help those who help themselves, right? Wisdom is the key thing. And the Bible says, get wisdom, and in all you're getting, get understanding. And so, are you going to sit and say, God is going to do this or God is going to do that? What are you going to do? God will give you the tools, because sometimes healing is progressive. And so, what are you doing to help that process, right? And so for me, I'm going to do all that's necessary to aid in that process of full healing for my children, right? And so I implore you guys to do what's necessary to have your child experience the best life they can possibly have being on the spectrum. Thank you guys for watching. Join me next time as I go into different topics and contents on Autism Speaks. Are you listening? Bye.